Hello, and welcome to our webinar today. We're going to be discussing the No Surprises Act. This webinar is particularly for healthcare providers and facilities, and their requirement to provide a good faith estimate of expected charges for items or services to individuals that are either self-pay or uninsured. We're going to go over all of the aspects that you need to know so that you can avoid $10,000 penalties that are attached with this law. You may have heard of the No Surprises Act and dismissed it because in private practice, you did not feel that this law affected you because what we've heard mostly about is how it affects hospitals and emergency care. Effective January 1st of 2022, all licensed medical providers are required to provide a good faith estimate to uninsured or self-pay individuals. This new law has substantial requirements for your office to comply with some very short time frames. And to meet the legal requirements, you must have a valid form, meaning that there are certain elements that must be on the documents you present to the patients. This law applies to all licensed providers who treat uninsured or self-pay patients. Even if you are not a HIPAA-covered entity because you only accept cash, this law will apply to you. It includes small practices, even though you may not have the resources to be able to comply with the administrative burdens imposed by this law. So one of the first questions is, what initiates the need to provide a good faith estimate to an individual or patient? Well, this is your office's responsibility. Your office must inquire and determine if the individual meets the definition of uninsured or self-pay under the law. It is your office's responsibility to determine if a good faith estimate is required. So upon scheduling an item or service, or upon request, you must determine if the individual is, one, enrolled in a group health plan. If they are they going to apply their benefits? If not, they fall under the self-pay category and a good faith estimate is required. If they are a member of a federal healthcare program or a healthcare benefits plan, then that is going to be exempt and you are not going to be required to provide them with a good faith estimate. Unless any individual or patient asks you about the potential cost. Any conversation as to the cost of a service or procedure is going to invoke your requirement to provide a good faith estimate. So the good faith estimate, GFE, is going to be a notification that outlines an uninsured or self-pays total expected charges for this service or item requested. So the good faith estimate not only includes your charges and fees, but any reasonably expected to be provided services and fees in conjunction with your primary service. So let's go over a few definitions. So if the individual or patient comes to you and requests the pricing, or you determine that a good faith estimate is required, you are the convening provider or convening facility. You may have to reach out to other co-providers and co-facilities to do the full good faith estimate that is required by this law. So many of you, especially dental offices, plastic surgeons, already give patients an estimate of their charges when you do their evaluation. This is a good example. You're seeing here that the patient went to the dentist, and now we have the treatment case and treatment plan, the expected charges that are going to be sent to the patient. This is wholly inadequate. This will not protect you under this new law. A good faith estimate has numerous required elements. If they are missing or incomplete, you do not have the legal document that you need to protect yourself. So our good faith estimate has the requirements in red. So for the patient's information, it's very simple. Patient's first name and last name and their date of birth must be on there. You must, in plain English, list the primary service or items, along with the primary diagnosis codes that may be involved. Your legal name, not any doing business as names, but your legal business name must be on there, the address where it will be performed, along with your NPI, your National Provider Identifier, and your taxpayer identification number. Going further, again, the items in red are required. We have to have the service item, the diagnosis codes, the quantity, and the total expected cost. Now the first part is from you as the convening provider or facility. And here, again, all expected charges. So now we have to reach out because we feel that there could be a prescription. We feel that there could be a co-surgery that's going to be involved with this. Now we have to send this out to the co-provider, who must also complete in their legal name, the address where the service is to be performed, their NPI number, their TIN number, and their list of diagnosis codes and expected charges. I want to point out here that an individual can come up and ask you for all of this information, and before you see that individual, before they're a patient, you don't know this information. So you will use to be determined so that you can show that until we get further information, we can't give a completed good faith estimate. Again, this needs to be an itemized list grouped by each provider or facility that is reasonably expected to be furnished in conjunction for that period of care. And again, use to be determined, TBD, when you have an individual that has not been seen and still request or you're required to give the good faith estimate to. After gathering and putting together the previous pages of the good faith estimate, we must also include these disclaimers. This is, again, a requirement under the law that we document that we gave all these disclaimers to the patient. Now, on our form, the patient can sign, but is not required to sign for this to be valid. So on the good faith estimate, many of the co-providers or co-facilities will just be kind of normal, thinking that, yes, we're doing a colonoscopy on this patient, so we need to send them to the surgery center. So they may be a co-facility. We may also have a co-provider in the anesthesiology group. We have to reach out to them as well. But don't forget, if there's going to be any medications involved, we are going to have to reach out to the pharmacy to get a good faith estimate from them as well, which in many cases is going to mean to get an accurate good faith estimate, we're going to have to know where that patient gets their prescriptions from. If the good faith estimate is going to be for recurring primary items or services, then we are required under the law to do a 12-month scope and list for the next 12 months all of the expected services and charges that we're going to have and include those on the good faith estimate. This is where this can really become burdensome because now, as you see that patient, that good faith estimate is most likely going to change and you're going to have to maintain it and keep it updated. So for the uninsured self-pay patients, this becomes an ongoing responsibility that you update the good faith estimate, not only for your services, but for any co-services or co-providers as well. The No Surprises Act establishes requirements for the content that must be included in your good faith estimate to an uninsured or self-pay individual. All of the required elements must be included in the good faith estimate. So let's get started on going over what must be completed for this to be considered legal under the No Surprises Act. Well, first of all, we need to have the patient's information. There, we are required to have the patient's name and date of birth. Next is a description in clear and understandable language of what service or items are to be provided. You should also put the patient's primary diagnosis code and secondary diagnosis code onto this form. Next, we have the convening provider facility. That is the provider that is completing this request for the uninsured or self-pay patient. Understand that in all of these provider facilities, we need the legal name of the entity, not their DBA, not what they're commonly called, but the legal name. Also included must be their NPI, National Provider Identifier, and taxpayer ID number. When it comes to providing the items and services, the law is very specific that it is a detailed, itemized list of all the items and services reasonably expected to be furnished for the primary item or service to be rendered. So we need to have these service codes, the description of an item or service using the current procedural terminology, CPT code, healthcare common coding system, diagnosis related group, or national drug code. The diagnosis code that the individual describes the individual's disease, disorder, injury, or other related health conditions using the ICD code set. The expected charges associated with each listed item or service. Once the details of these services and items from the convening provider are in place, you should total them up and then add that to the total expected charges from the convening provider or facility. Now, you can add additional tabs here. If you don't know how to do it, just come over here, go to this table, hit copy, and you can copy and then paste if you need additional providers. We've listed on our form co-provider facility number 1 and co-provider facility number 2. And here, again, we need the provider facility legal name, we need their NPI number, and we need their taxpayer identification number. Again, the co-provider facility must list a detailed listing of the items and services that they will be providing along with the expected cost. And then again, go ahead and total up those costs. Now, our form again gives you a second one, but we can always add more. If you're going to a surgery facility, you're probably going to have the convening provider facility. Don't forget adding drugs, labs, or other facilities that could be required. In this section, you will want to complete what we've put together by, again, listing the primary service or item, the dates of service if they're known, or when you expect them to be done, and also include whether or not these items and services will be recurring. So a patient or individual that is uninsured or is self-pay could ask you for an estimated charges for the year, and as long as you don't go over that 12 months, that is required. Now down here at the bottom, it definitely put in the date that this good faith estimate was performed, and add up the charges from the different convening provider facility and co-provider and facilities to give the individual who is uninsured or self-pay a total estimated cost for the services. The last page of our good faith estimate are the required disclaimers. The first one, very important, this is not a contract, and the patient is not obligated to have the services that are listed. There are others that go over, again, that unexpected cost may arise, but that if the estimated charges exceed the actual charges by $400 or more, then the patient has the right to go to a dispute process to resolve the difference. It also tells the patient to make sure that they keep a good faith estimate copy for their requirements. Now, the patient does not have to sign this. I would always recommend getting the patient to sign it and keeping a copy. This is a part of their medical record and will be held as such. Now, Under the No Surprises Act, as a healthcare provider or facility, you are required to inform the individuals or patients verbally and in writing. So if the patient requests you to go over it, you must do so verbally. Even if you do it verbally, you must also provide the patient with a written version of the good faith estimate. The No Surprises Act has requirements for postings that we provide good faith estimates to self-pay and uninsured patients. These must be, one, in your waiting room or lobby area. They must also be on your website, prominently displayed, which means on your home page. And they must also be put in any rooms where financial considerations could be discussed. Section 1557 applies here as well. If the patient is non-English speaking, we must have these good faith estimates in whatever language the patient understands. There are very quick timelines for you to respond to the good faith estimate request, or when you determine that the patient is required to receive one. If you schedule the patient out for 3 days, then you have 1 day to do your estimate. You then have to send it out to the co-providers or co-facilities. By law, they have 24 hours to turn it back around to you, because the patient has to receive the good faith estimate 1 day before their actual service or item. If it's scheduled out 10 days, then you have to have everything completed and the good faith estimate to the patient 3 days before that date of the scheduling. And if an individual or patient requests a good faith estimate, you are allotted 3 days to provide that request. As I stated, if you are a co-provider or co-facility receiving the good faith estimate from the convening provider or facility, you have no later than 1 business day to get that back to the convening provider or facility. So under the No Surprises Act, if the patient or individual receives a bill substantially in excess of the expected charges, then the patient has the right to go to a selected dispute resolution process. Here, an arbitrator will determine what fees the patient will pay. To provide clarification, the government has told us that substantially in excess of the total expected charges is when the actual amount exceeds the expected amount by $400 or more. So $400 or more in excess of the good faith estimate will trigger the arbitration provision of the No Surprises Act. Preparing for binding arbitration. To invoke this, the patient, once receiving a bill that is $400 more than the total expected charges, only pays $25 to forward this on to that mediator or the arbitrator. Now, under the good faith estimate, we have the convening provider and the co-provider and co-facilities. If every provider went over by $300, the total to the patient would be $900 more, but would not invoke the No Surprises Act because no provider went $400 or more in excess of their estimated charge. So only those providers or facilities that exceed their estimate by $400 are going to go to arbitration. If your good faith estimate meted your expected charges or did not exceed $400, you will not be required to go to arbitration. If you do have to go to arbitration, then you will need to have defenses to present to the arbitrator on the acuity or complexity of the services provided, that the scope was greater than expected, or that there were complications during treatment. So there are defenses to allow you to recover your actual fees. But again, they will have to be submitted to an arbitrator. So again, another difference with the No Surprises Act versus HIPAA is that under the No Surprises Act, when you communicate with the co-providers or co-facilities, you must be using secure communications, which in many cases is going to mean you must use encrypted email. You also, when you are sending this to the patient via email, that must be encrypted as well. So HIPAA allows you some variations there. Under the No Surprises Act, we must be using secure messaging. So all of this information from the No Surprises Act must be documented and retained as it becomes a part of the medical record. That's going to include your determination. Is this a self-pay or uninsured individual? Of course, any request for a good faith estimate, the good faith estimate itself, any resolution processes that you go through. All of these are part of the medical record and must be retained under your state law or for a minimum of 6 years under the Act. One of the disclaimers on the good faith estimate is that this is not a contract. There is no obligation for the individual to go through with the service or item that they're requesting. So once patients do find out about this, they are going to start shopping and they're going to go to different providers. So you may be getting a lot of requests for good faith estimates from uninsured individuals who are trying to get the best price. So again, this is not a contract, and the good faith estimate must state that to the patient. This is an interim final rule. That means that it is currently in effect, but it is still undergoing transitioning. The next expected part of this law is going to be good faith estimates for all of patients. Now, the reason for that is that many insurance plans now have high deductibles, so the government feels that once we get you started this year, next year we're going to require it for everybody. I'm recommending that everybody get with their EMR company to do these. All of the ones we have evaluated so far that have cost estimates do not meet the requirements, do not have the elements that are required on the good faith estimate, so you cannot use them. Work with your EMR companies. Get this included because this is a substantial burden and you really need to have help to make sure that this is done properly. If you've not already received it, you need to make sure that you get a copy of our No Surprises Act compliance package. It has the required good faith form, reference materials, the required posting, training, and other documentation that you need to comply with this new law. Thank you for your time and attention today. We do expect that you're going to have questions on this. This is a very complicated, substantial burden to your practice. So please feel free to give us a call at 813-892-4411 or email us at mm@HIPAAcompliancekit.com. If you're a current customer, send us an email. We will be happy to get these materials out to you. If you're not a customer, please call. We'd like to discuss this with you. Thank you again. Have a great day.